The PharmCast is a podcast sponsored by the Maryland Pharmacists Association. I'm your host, Aaliyah Horton. I'm the Executive Director of MPHA. And in my role, I have the opportunity to meet so many fascinating people within Maryland and around the country that are engaged in the practice of pharmacy. They're stakeholders, they're innovators, collaborators, and advocates. And this is my opportunity to bring those conversations and experiences to you. And it's another way that MPHA is fulfilling its mission to strengthen the profession of pharmacy, advocate for pharmacists, and to promote excellence in pharmacy practice. My hope is that at the end of these conversations, you will leave informed, engaged, and connected to pharmacy and our Maryland pharmacy community. Hi, welcome to the PharmCast. Today, thank you. Thanks for being here. Today I have Krystal Weaver, who is the Executive Vice President and CEO of the National Alliance of State Pharmacy Associations, or NASPA. She has focused her career on pharmacy advocacy, policy development, and regulatory affairs, working to enhance pharmacists' prescriptive authority and improve patient care through increased access to pharmacist patient care services. And immediately prior to joining NASPA, in the current role that she has, she served as an associate at Sidley Austin, counseling pharmaceutical and pharmacy clients on regulatory and enforcement matters. She holds a Doctor of Pharmacy degree from the University of Toledo and a Juris Doctorate from George Mason University. And Krystal and her family live in Alexandria, Virginia. So, welcome, Krystal.
Thank you.
Yes, I'm so happy to have you. So, for our listeners, and we actually do have quite a few listeners, and I don't know if I told you this, we were ranked number 3 for Maryland Medical Podcasts by FeedSpot. So,
Wow.
congratulations to
Kudos.
us. Yes, thank you.
Very nice.
Yes, and so as we kick off 2025, I was really happy to have you on because, again, as our subscribers know, Krystal was actually the first interview we ever did on the podcast. And so a lot has happened since 2019. And so I wanted to talk to you a little bit about that because we've had a lot of transition. And so I was joking around saying that a lot of adulting has taken place over the last few years. So when Krystal was on, and we were talking a lot about pharmacy associations and the state of the profession, Krystal had just started in law school. And since that time, as I mentioned in the intro, she's completed law school, worked in private practice, and is now back as essentially the CEO of the National Alliance of State Pharmacy Associations, or NASPA, and has a full-blown family. And so it's really great to have you back to kind of talk about where we are. So, look, welcome, and sort of what's
Thank
going on.
you.
So what do you, when you think about that and that transition, like sort of what comes to mind?
The professional transition, personal transition, so many transitions have happened in the last
Yeah.
5 years, not to mention the world, turning upside down, this little global pandemic that happened in between the last time we spoke.
Oh my gosh. I even forgot about that. Yeah.
Wasn't at all on our radar at that point. No one had heard the word COVID-19 yet. Yeah, so much has changed, all for the better. I started law school while I was at NASPA to advance my policy prowess. Frankly, it was my original intention, and fell in love with law like a total nerd. Dove into Supreme Court clinics and moot court competitions, and really loved it, and went down the path of going into a private law firm, and a big law firm, which is its own world that I learned all about. I didn't know existed. I learned so much working from, the top lawyers in the country in healthcare law. Really amazing colleagues I had there. And despite what you see on Suits, it was actually a really nice culture at the firm that I was at. I was really lucky and had a great team. But then, NASPA was going through some transitions, and my heart has always been in pharmacy. I stayed somewhat involved. Big law keeps you pretty
Mhm.
busy, and so I didn't have the same level of activism in pharmacy that I had before, but still participated in national meetings and a couple state activities too. And you know, my heart was always here. The legal world doesn't have the same uh, tight knit community, I would say, that our pharmacy world has.
Mhm.
Certainly, they have their associations that are huge and massive. There's millions of lawyers in this country, um, but it wasn't the same community feel that I felt with my pharmacy family. And so when NASPA was looking for a new leader, I was really drawn back to be with my friends. Many of my close friends came from my first round at NASPA, and so was really happy to be able to come back and rejoin the team. On a personal level, yeah, everything has changed in my life. We bought a house, we had a baby. I've got another baby on the way. We've got two cats and a dog. It's madness around here.
Yeah, like I said, it's full on adulting.
It's full on.
Full
There's
on
no
adulting.
escaping it now.
Yeah. And I really think it's interesting, the folks who have their pharmacy degree and go on and do other degrees, whether it's an MBA or a JD, but still remain very close to the pharmacy community. Because you're right, it is kind of a family, it is close knit. And I imagine it's hard to kind of break those ties. So it's very interesting to me, as the executive association, really seeing how people from who are practicing pharmacy in a sense are practicing it in so many different ways and have an impact in various ways across the profession. And there's so many that I mean, I still don't honestly, I still don't even understand sometimes, but it's really cool when they pop up, like when we talk about the nuclear pharmacists and other ones. You know, if you mentioned, hey, I'm a nuclear pharmacist, people would say, what are you doing? But but I really think it's interesting about, you know, all the opportunities that people have in the community. And you talked about the transitions, and so it is, I think, pretty cool that you're back at NASPA in a different role. And over the last year, we've worked very closely together, because I've been serving as the NASPA president. And so I think for each of us, it's been a transition in that you're coming back, you have come back in a different role, in a higher kind of leadership role with a different perspective on your contributions to the association. And in my role has been very different because I've been a member. I've served on the board and obviously been a member since I've been at MPHA for the last 10 years. But when you take on that leadership role, it is very different. And I would say serving on the board and serving as president of NASPA has really given me greater empathy, for my board members and for my leaders in terms of the expectations, in terms of from membership, as well as the expectations of um, the board and other members and engaging with you as the CEO. So it really provides a greater perspective on all the different ways we can impact the pharmacy profession. And it's a lot. So it's
It's a lot.
talking to someone, you know, about, you know, especially with what's going on now in the pharmacy profession and the pharmacy world, whether it's the focus on pharma companies and drug pricing, the pharmacy benefit managers, and the impact on community pharmacies, whether it's retail or independent, the impact on the pharmacy workforce. And then, you know, we have a new administration with a different perspective on the federal role of in public health, potentially. And particularly in Maryland, we have a lot of folks who work in the federal government, whether it's FDA, NIH, DOD, CDC, you know, all of these different entities. It's a
It's a lot.
marathon with lots of sprints in between. So As you think about that, so what's been like this year, what has been, let's say the peak of some of what you've been working on and what NASPA has been focused on?
So we really spent a lot of energy, as you know, working on our internal processes, making sure that we had all of our ducks in a row, that our staff was stable. We've had some staffing transitions to make sure we have people in the right roles and the right kind of expertise to be able to support our state pharmacy associations. So that's been a lot of energy that we've put into this year. But I'll also say my vision, and I think aligns with the board's vision, is that NASPA's unique role in the profession is to provide that high level look at state policy across the country and making sure that state pharmacy associations have the policy resources they need, that our partners, our associate members, our national partners have a good sense of what's happening in the states and really appreciate and understand how important state policy is. And I think there's a growing appreciation for the importance of state policy. And I think the most important thing that NASPA can do is to keep reminding everyone, all the stakeholders in the world, or at least in the country, that the state pharmacy associations really are the most influential voices on the professional pharmacy issues at the state level, and that we have to make sure we're getting resources to them. It's great if a national company is interested in a particular policy topic, but if they swoop into a state and try to make specific changes happen, first of all, local legislators say, get out of town. you don't
Hmm.
know you don't know our state, and they don't know the state as well as they might think they do, or as well as their local lobbyists tell them that they do, and they could end up messing stuff up. And so really the best strategy is to have those national partners align with the state pharmacy associations, work together. I think it's even a more cost-effective strategy for them to support the state association versus hiring expensive contract lobbyists who won't be as effective as Aaliyah Horton would be if they would just partner with you on issues where priorities align. And so I really take that responsibility to heart in my role at NASPA to keep that coordination happening. And you asked about the peak for the year. I think one of the most exciting things was a partnership with McKesson, where they're helping to support the state pharmacy associations through their program called Amplify.
Hmm.
And I'm really excited. I really believe that we'll look back at 2025 as kind of a turning point where state associations got resource support, and it'll help state associations to move in the direction that they want to move when they have that flexibility to
Yeah,
have the funding that they need to focus on advocacy. You know more than anyone, advocacy doesn't pay the bills,
it does
but
not.
it is all
It does
mission.
not. It's,
It is all
yeah,
mission work, and it's what pharmacists need the most. But our associations are spinning their wheels trying to raise money because membership keeps going down.
hmm,
So pharmacists out there listening, thank you. I'm sure you're a member of MPHA if you're listening to the podcast, but please drag along your buddies to pay their dues and get engaged in the association. We just really have got to find a way to activate pharmacists to support the associations financially so that they can do what they do best, which
yeah.
is the advocacy work.
Yeah, and I just want to circle back on one of the things you said when kind of folks come from outside to influence state policy. It's very interesting. Sometimes it can work really, I know it can work really well when we do work together. And then when it's sort of operated in a vacuum or a bubble, because this issue is important from a national perspective, but the nuances of what's happening in the state aren't taken into consideration. And, we've run into that, and I expect we're going to run into it again this legislative session because there are some issues that we have been working on with partners for many, many years, and it is a primary focus related to ensuring that our pharmacies are reimbursed for their drug acquisition costs, and our pharmacists get paid an appropriate dispensing fee. Because as you know, it's as little as 0 to 25 cents sometimes, and pharmacists are dispensing medications that they've purchased at hundreds of dollars. at a loss. And there are lots of other important pharmacy issues, but we have to make a decision as to where do we use our political capital? Because we don't want a situation, and I think I can speak for a lot of the state associations where something may come in as a pharmacy related issue, and the legislature says, okay, great, we've addressed this pharmacy issue, be happy, go away. And the fundamental piece of kind of sustaining pharmacy practice, or at least a pharmacy practice that the public is mostly aware of, because I think 50% of pharmacists work in a community pharmacy setting in some capacity across the country. And if we can't protect that, all of these other things really don't mean as much if people don't have a place to access their medications. They don't have a place for accessible care. And so we do have to balance that. And sometimes it's very hard when you're looking from the outside, even from the member perspective. And like you said, when we're talking about these national issues, saying, well, this is so important. And it is. But we have to balance. We have to read the room. We have to know who the political leaders are on the committee, who's got a chance to get a bill passed, who's not going to get, like, there's no way in hell this person is going to get any bill passed, regardless of how good it is. So all of those pieces play a part. And I think the state associations, with the support of their membership providing the input, have been really effective in getting things done. And honestly, that is why a lot of the national folks are focused on state policy, because it's not happening in Washington. Washington is not moving. As much as we try to participate there as well and push it, it's a balancing act for sure.
100%. Yeah, and I think that it's really that, like you were talking about it in the advocacy space of the nuance that happens in a given state, but it also extends to the other side. Like a bill's passed and the bill has to get, or the policy has to get implemented. That
Yes.
implementation is so variable state to state on how it works.
Hmm.
And our national partners, if you're a pharmacy chain operating across 50 states, how can you possibly operationalize addressing those little implementation nuances? I know your folks have run into issues with the Medicaid department and how they're
Hmm.
implementing the payment for services.
Yeah.
And it's only the Maryland Pharmacists Association, yourself and your leadership, that can possibly get through working with your local Medicaid agency to get it sorted out.
Yeah. And we,
And so it's just so
I do want to
essential.
say we love our national partners. Don't
Yeah,
get
of
that
course.
wrong.
But to work
This-
together,
we
working
have to work
together.
together. Yeah, for
Exactly.
sure. And that
And
is
just
really,
highlighting like the essential nature of the state
mhm.
pharmacy
Yes.
associations and the essential nature of that partnership and having those lines of communication open and getting their pharmacists involved. We've got to get, from all different settings, pharmacy chains, managed care organizations, all of that. We need those pharmacists to be engaged with the state association.
Yeah, and that also builds on something that I've learned over the last couple of years. When you're talking about the implementation, we've done, I would say, a pretty good job in getting a lot of scope of practice advancements and different um, scope changes made, right? And then we are challenged with the implementation, and we have a lot of independent, innovative folks working in independent pharmacy. We have a very active CPESN network in Maryland, Community Pharmacy Enhanced Services Network in Maryland. And that's one area of practice, so to speak. But when we look at the chain implementation of these scope changes, one of the things that I've learned over time, and that has been because we worked with national partners, have participated in the stakeholder working groups held by whether it's NACDS, APHA, NCPA, is learning that it's very hard for the chains to implement those changes, particularly like in our area, where we have Maryland, DC, Virginia, and even Delaware. So it's either Delmarva or DMV, whichever one you want to talk about, um, where we've all got these different types of changes. And for a chain, they really need to implement across a region. And so I think that's the other part of the importance of the collaboration within NASPA is that we have this forum to talk with one another and figure out how we can work together as best we can. Because again, we talked about the nuances of all the legislatures and everything, but do the best we can to make it so that there's
Harmonize.
some to harmonize, so there's portability. Because even in Maryland, a lot of our pharmacists are licensed DC, Maryland, Virginia, and Delaware, and they want to be able to practice and talk about the confusion, right, of being licensed in a place where you can easily work in any of those four areas for states, three states and a territory, and each practice act is so different. And so I think that's one of the things that I really enjoy about NASPA is just trying to figure out how we can all get to sort of the same place, which is really
Absolutely.
important and share information.
Yeah, that cross-state implementation is just nearly impossible for our chain partners.
Hmm.
And that's something I'm really passionate about that we started at during my first round at NASPA was bringing together stakeholders and identifying those best practices for policy recommendations so that the state associations can say, look, here's the list of best practices from our experts across the country. Let's get our state up to par, and then we can get folks closer to that like similar scope, similar nuances to the law, as close as we can.
Yes, and actually that just reminded me of, I would say this is a big peak and exciting thing for 2025 is you got to tell me what it's called.
Yep.
I
So
know
we have a pharmacy technician scope of authority
no,
project.
no, not
Oh,
that one, not
another
that
one.
one. The legislative database that people can purchase. I think you came up with a
Yes.
name
Farm
since
Law Navigator.
Farm Law Navigator, which is a great opportunity so that the state associations that are members have access to this, but it's also I guess a subscription option for outside partners to really look at the full scope of pharmacy practice across the country by scope areas. And it's a fantastic resource that you guys pulled that out in in 2024, 2025. And I think it's going to be fundamental to the work of the individual states to really be able to see what's happening, pull the best pieces. But um, I don't know if I'm talking in circles, but what I wanted to say was that oftentimes when we're trying to figure these things out, we're on the listserv asking, hey, do you have this? Do you have that? And now we have one place where we can go. It's vetted. We know the information is correct, and we can go to a one-stop shop and pull that information. So it's really fantastic for all of us to
Yeah,
do
thank
that.
you. We're looking forward to launching that. We
Yeah.
were hoping to be ready in January 25, but our technology development process for anyone who's gone through that kind of
Yeah.
endeavor got a little delayed. But yeah, we're really excited about it. And what I think is really needed in the market is that like local level of knowledge where something's unclear and you know lawyers
Hmm.
will interpret it in the most conservative way, where we work instead of just doing a conservative interpretation, we reach out to the local leaders at the State Pharmacy Association, their partners at the boards of pharmacy, whoever that might be that has the right answer for what's really happening in practice. Like this is the
Hmm.
actual nuance that you can't see in the letter of the statute, because there was an attorney general's interpretation, or there was a board of pharmacy interpretation that came out,
Hmm.
or this is just the way it's been done for years and years. So we're hoping that that'll be a really great resource for the market and allow pharmacists to use the full scope of authority that's been passed in the states.
So stay tuned,
Stay
right?
tuned.
Stay
Yes.
tuned.
Farm
Yes.
Law
Okay.
Navigator. Yes.
Say it again, Farm Law Navigator.
Yep.
Awesome. Okay. Well, so one of the things I guess the theme of this is transitions, right? So one of the other things that's been really interesting over the last couple of years has been quite a bit of transition in State Pharmacy Association leadership. And in looking at the history, what I have seen is that there have been state association leaders that have come in and essentially it's been a career long, 20 plus years. And we are seeing a lot of churn because of the challenges in the industry. It's not an easy job. And excited that we have a lot of new state association executives. And I think that's also the important role of NASPA is supporting these new leaders in these spaces, and they're a mix of pharmacists and association executives, which I think is also a bonus because we all kind of feed off of one another in that. And so what are your thoughts on some of the transition and the newness in this in the membership essentially as you've come back to NASPA?
Yeah, absolutely. In the 5 years that I was gone during law school and working at the firm, 30% of the state associations had a new executive.
Hmm.
That's huge turnover when we're just
Yeah.
talking about 50 organizations, 51 with DC. Yeah, I think it really comes down to resources, that the state associations are resource needing a lot of resources that they are having trouble accessing because of membership declines. We've got to get pharmacists more engaged in our associations to get those resources more available. And that's, to pay the execs enough. Most of them are underpaid for the amount of work that they do. It's also to get enough staff to support the state association executive, who, even if you're in a state that's lucky to have staff, you're still doing 3, 4 different jobs
Hmm.
to get it all done and make it all happen. Um, and to some extent, that's the life of a nonprofit.
Yeah.
But I think it's really challenging with these state level organizations, and it's a hard job, and it's a hard market right now for the pharmacy profession, and so you're faced with challenges that feel like there's no solution. When our pharmacists are facing these workforce challenges and working condition issues related to not having enough hours, and you know, I don't. Uh, I have empathy for the decision makers who have to cut the hours because
Hmm.
the challenges that our independents are facing with reimbursement rates and all of that, chains are facing too.
Yeah.
And
Yes.
if we don't make the business model work, not only will there not be enough hours, there won't be jobs. Those
Hmm.
pharmacies will just close. So, it's really tough for these decision makers, whether it be a small business owner, pharmacist, or a large business like a chain pharmacy. It's really hard for them to make these tough decisions. Like, do I cut hours, or do we close the store?
Hmm.
And pharmacists need jobs, so we don't want the store to close, and patients
Right.
need access to their medicines. So, anyways, all that to say is that it's a tough environment to be working in, facing these really tough issues. And I know our state association executives really internalize them. I know that you do. That we care about it. It's
Hmm.
personal when our members are suffering. It's hard to keep going. So, I have so much respect for our state association executives who put in blood, sweat, and tears to these jobs with so much passion. I know they lean on their volunteer leaders, but I think I think there's a tendency among our state association executive leaders to hide how hard it is, and grin and bear it.
Hmm.
And so I think that has contributed to the turnover. I think there's also just like a cultural shift that people don't stay in the same job for 30, 40 years,
Hmm.
like the good old days. And I don't know that that's all bad.
Right.
I mean, I can think of, some really wonderful leaders from the past who stayed in their jobs for 30, 40 years. So this is not to discredit their legacies. But there's value in having new voices come in, shake things up, kick the tires a little bit and see where we can make improvements. So
Hmm.
it's not all bad. But I take the responsibility to heart of what you were alluding to, that, it's NASPA's job to help ensure continuity, to make sure that our pharmacists who are coming into state exec positions have the association management resources they need, and that our association managers coming into those positions have the pharmacy policy resources they need.
Hmm.
So we're always trying to balance that, with our limited resources, and figure out how we can help the state execs to get up to speed through NASPA staff, but also by linking them with more experienced state execs who can help pull them along. And that's like the real beauty of the NASPA
Yeah.
community.
Oh, for sure. For sure. I
Yeah.
can tell you it is a trajectory because when you first come on, there are all these questions coming out and you don't know, well, can I really contribute this? And then at least for me, like when it first came in, I was like, I don't know if I should say anything. I don't know if I should say anything. And now I'm like an old head at this point. So,
Experienced, not old.
experience, yeah, seasoned. Um, and I always think back to one of our first conversations when I had come to MPHA and I had a lobbyist who was representing a pharma company and he was asking for our feedback on this biosimilar bill. And I read it and I read the bill and I was like, I don't know what this is. I called you. I was like, what the heck is a biosimilar? You walk me through this. You were very patient in walking me through that. And I always appreciated that. And it's always kind of stuck in my mind. But I think that's one of the things that we do as execs, like you said, between the pharmacists and the association folks, filling in the gaps for one another. And I think that is what's created a really strong bond for all of us. It really is a family
Well, it
for
warms my
sure.
heart to hear that that sticks out in your memory.
Oh yeah, it totally because it's funny because it's just funny. And the person, I'm not going to say the person's name because if I even describe it, any of the Maryland people in Annapolis will know who it was, but the person can be very intense. And so I had like multiple calls in like 2 or 3 days. And I was like, I got to figure this out. I've got to do the research. This was the same time as something related to PBMs was blowing like a huge blow up. They kicked all the pharma independents out of um, United Healthcare, kicked like all the pharmacists out of the network. And, this person is calling me about biosimilars. I'm like, I've got to, again, a marathon and a sprint. We got to figure
Yep.
out how to deal with these. And so that was just really helpful. And it stuck out for me. So let's see. What was I thinking about? Yeah. So I guess, so what's next? We talked about the farm law navigator. And actually, you know what? I wanted to circle back to something else. So I was looking at that first podcast that we did, and one of the things that I always do in the at the end, I always ask people what they do for self-care. We were just talking about the kind of challenging environment, a little bit of burnout, and sort of internalizing of things. And so I went back and listened to what you said that you did for self-care. And one, it was not much. And two, it was listening to podcasts that are not related to pharmacy or law. And so, as we talked about transition and the changes that have taken place, what's different at this point, so many years later?
Well, first, I will be vulnerable in sharing that was a difficult time in my life. Any pharmacists out there thinking about going back to law school, please do not work full time while going to law school. Part time law school, I think would be fine. But working full time and going to law school part time, which is only one fewer class per semester,
Mm.
um, than full time school, was the hardest thing I've ever done in my life. My mental health really suffered during that time, and that's why I stepped back from NASPA, was to like
Mm-hmm.
refocus on my own health and focus on law school those last 2 years that I was in school. So yeah, my self care was very limited at that time. I my life has changed a lot since then, and so in terms of like taking time for myself, self care kind of thing, I think right now, my current status of life, it's really setting work to the side for some time each day and spending
Boundaries.
real
Okay.
boundaries and spending like real quality time with my daughter.
Awesome.
Um, I, anyone who's had a toddler knows that that's not like the purest form of self-care. But it's really meaningful to like have a phone-free one-on-one bonding time where we just play. I'm not trying to
Hmm.
get the house clean. My house is not going to be clean while I have toddlers in it. That's just not who I am. Um, and we're playing with something that is engaging to her.
Hmm.
So I think that's probably the most consistent self-care routine that I have, is that I set work aside and really just focus on her and our connection. And my husband is very supportive. So for Christmas, he booked me a night in a hotel and a spa day, and some time away from myself. So I think it's really important to have a supportive partner
Hmm.
who sees what your needs are too. And then, like you said, boundaries. My New Year's resolution, I know you'll laugh at me for this, you have before, is to stop working at midnight. Never working past midnight again for the rest of 2025. Aiming for earlier.
Yeah, I've
Uh,
really been working with her, trying to get it earlier, but you know, baby
but
steps.
like a hard cutoff. Like I
Okay.
cannot work past midnight.
Yeah.
And I have stuck to that this whole
Good.
month of January, which is longer than any other New Year's resolution I've had. What about you? What do you do for self-care?
I would say I am very committed to my workouts, and because you hear all about it all the time, but um, I have never been so consistent in my life. I always joke like I may not look like it, but I am actually very fit. I'm like really strong now. Like
I
I've got
think you look
muscles.
very strong.
I've got muscles. And so, but just that consistency it was just sort of what I've been doing is building. Because I would say, yeah, COVID was really, really challenging and was probably like peak of like near burnout for me
Yep.
around that time, which for a lot of people as well. And so I just committed to trying to be better and just build, whether it was boundaries, building exercise routine, doing the best I can with my eating, trying to figure out like what's going to keep me at optimal performance. So it's lots of different things. And I always have something new that I have to share. Lately, it's the adaptogen mushrooms, which we can do a whole nother podcast on that. Um, and but I think that's really it. And then finding those things and then staying consistent. And so that's been really, really helpful for me. And then also, I think what I shared with you after we kind of had to deal with a challenging thing is that um, when something bad or challenging happens, it's for me, it's more in the workplace because I do internalize a lot of it, is to just feel the feels, like say this sucks, it's horrible, acknowledge that and then say, okay, now we're moving on and going to do something else. And that has been really, really helpful for me and to not wallow.
That's a
So
great
that's it. But I
framing.
think all of those other supports have helped to build up the resilience in that sense.
It gives you like the space to be able to manage the things that get thrown at
Yeah,
you.
to do it, but yes, the resilience to bounce back quicker
Yep.
than to sort of stay down, but to just come
Yep.
back. So yeah, so that's where I am. And I
That's
think,
great.
and that's also, if you remember, so that was 2019, late 2019, we started this podcast. And that's why I was asking the questions, was to get ideas. And so over the time, I've gotten some great ideas from people who have interviewed over the years. And so this
Amazing.
has also been a very fun process of being able to talk again on a one-on-one with the people that I've met. And a lot of it has been through the NASPA meetings and making those connections at the national meetings and through NASPA and saying, "Oh, we had such a great conversation. Let's bring this back." Or just some policy topic popped up at one of the meetings and I was able to find someone to talk more about it. And so that's been really fulfilling for me as well. And to
That's
get to share
fantastic
it with
to hear.
everybody and make those connections. I'm a connector. So that's
Yes,
what
you
this has
are.
been about.
I
Yeah.
love it.
Yeah. Well, I think this has been a great conversation. I always love talking to you. Um,
Likewise.
but thank you very much. And I just encourage folks to follow NASPA on their social media channels, definitely LinkedIn. That's where I always watch you guys. I'm not sure if
Please.
you're on the
We're
other.
trying to build our LinkedIn audience, so find us on LinkedIn.
Yeah, yeah. So some really good stuff. And I know currently NASPA is highlighting the bowl of Hygeia winners over the past year and is being more intentional in highlighting those folks. And for those of you, I actually have international listeners. Just want to let you know that that's from all over the world. And so for those who aren't aware, the Bowl of Hygeia is a really high level award that is sponsored by the APHA Foundation and NASPA. And the state associations find the winners for each state. And it's really highlights a pharmacist who has taken on a strong role in community service. So they've really been active in their pharmacy professional career, but have also put in just as much energy in community service outside of pharmacy. And so it's a great way to highlight those folks. And NASPA is started to highlight them. And I know that our person from 2024 is very excited about that opportunity. And so I've been working with him. So shout
Wonderful.
out to NASPA for that work and to look and see what everyone's doing around the country is really cool.
Yeah, it is really cool. We used to share a compilation of photos of everyone,
Hmm.
but instead we're moving to the stories
Yeah.
because, there's so many great stories within those recipients. So I'm really excited to build that library of amazing pharmacists up.
Yes. And I will also give a shout out. We're again in the theme of transitions. I'm gonna be transitioning out of my role. The next incoming president is Penny Shelton from the North Carolina pharmacist. No, sorry, North Carolina, it's NCAP.
Association of Pharmacists.
North Carolina Association of Pharmacists, NCAP. Penny Shelton, who is a fantastic, thoughtful leader, and I'm just really looking forward to her, taking the reins for 2025, 2026.
Excited to work with Penny for sure, but I will miss you, Aaliyah. I'm
I'm
not
gonna
gonna
miss
let
you
you
too,
go
but yeah, I won't be far. I won't be far at all.
far.
Okay, well, thank you so much.
Thank you for having me.
Thanks for watching, and please be sure to like, subscribe, and rate the podcast on all major podcast platforms. We look forward to dropping more great conversations, and of course, sponsorship opportunities are available. Just contact us at MPHA. Thanks.